Welcome to Anti-Woke and Autistic. I'm going to jump right into this. Anna O'Brien, who many of you know, is on a fitness journey. She doesn't mention anything about weight loss, but we all know that one of her goals is to lose some weight. I gather that she doesn't want to talk too much about weight loss, if at all, because she thinks maybe she'll lose some followers who get overly triggered if they read anything or hear anybody speaking about weight loss. Anna has visibly lost at least 30 pounds, possibly 40. We all can see the difference, and that's great. However, she's still very heavy. She's morbidly obese, at least 100 pounds overweight. Part of her program is to do push-ups, and she started doing push-ups on a wall, and I'm going to show you that right now. I'm going to show you a video that spans a relatively short period of time, showing Anna's progress, if you want to call it that, regarding her push-ups. So she starts doing wall push-ups, and there's nothing wrong with that as far as risk of injury. It's pretty safe to do, but it's also very limited in how much strength you can develop doing wall push-ups. Wall push-ups are often recommended for elderly, weak people, frail people, but if you're younger and you want to progress with upper body strength and you need to start off with wall push-ups, that's fine if you're of a normal body weight. But if you're as heavy as Anna, and she appears to be around 330, somewhere around that, at 5'9", what are you going to progress to? Well, I'll show you what she's progressed to. You see what she's doing there? Limited range of motion. And you're not going to get many benefits with limited range of motion. Now, you're probably wondering, well, she has no choice because she's not strong enough to go down all the way. But I will tell you shortly what the alternative is, which is more effective and less likely to injure the rotator cuff. She's increased the range of motion, but her technique is very poor. For people who are not familiar with proper push-up technique, it might seem like she's doing them okay and correctly, but she's not. She's pushing out like this, which puts stress on the rotator cuff. She's way up here, way up here. Plus, she's pushing back against a lot of weight. You should be down lower when you're doing the push-ups. Down lower. So let's look at this again. So at the very end here, it looks like it's an achievement of some sort where she's progressed to this point from doing wall push-ups, but she's putting her rotator cuff at risk. The deeper her range of motion gets, it's only a matter of time. If she keeps this up, she's going to injure her rotator cuff. Now, I'm not saying she's going to tear it and need surgery, but she's going to cause overloading to the tendon, and it's just going to become a problem. The deeper she goes into that range of motion, starting out with very limited range of motion doesn't put a whole lot of stress on the rotator cuff. I mean, it does, but it's not nearly as risky as going deeper range of motion with your shoulders and arms up like this, especially against a lot of body weight. So over time, as she continues to get stronger, she's going to be doing more weight range of motion. And that's when damage to her rotator cuff will become more likely. So what should she do then? First of all, I'm convinced that the reason she's doing the push-ups is part of the showmanship of her program because she's pitching for Copilot, which is a fitness app, and push-ups are more interesting to look at when a fat person's struggling with them than if a fat person is sitting in a chest press machine and simply doing this. It would be boring watching Anna sitting in a chest press machine doing this. She does do lying down dumbbell presses. But again, there's something about push-ups, watching a really fat person struggling with push-ups, beginning against a wall and then against the handles of fitness equipment and then finally against a bench. And her body is almost straight. She still has a little bit of sagging. She has a lot of weight in front, and it's going to be really difficult for her as she increases her range of motion. It's unlikely that she's ever going to actually do push-ups on the floor with correct form. That's kind of like somebody a medium weight doing push-ups on the floor with 2 or 3 45-pound plates on their upper back. And at some point, if she keeps this up, she's going to injure her rotator cuff or at least put herself at high risk. Even slimmer people have been known to overwork their shoulder area doing push-ups, and they get the rotator cuff tendon injury, and it takes months for that to get back to normal. Anna is doing push-ups for the showmanship of it because she's pitching co-pilot. Here's what she should do. Now, I have 5 years of experience as a personal trainer, but any personal trainer will tell you this. For somebody her size, her weight, it would be a lot safer and more effective if she simply stuck to what she's currently doing, which is I've seen her doing flat or supine dumbbell presses as well as incline dumbbell presses. So she should stick to those. Those are safe. But she should also do, if she has access to a seated chest press machine, she should do seated chest press. See, the thing about push-ups is they could be very demoralizing because the nature of the movement is that if you're not trained, if you're not strong, even if you're thin, you're not going to be able to do them. And that's very defeating to the morale. It's demoralizing. For some people, it could be demotivating because you can't do it. You have to start out against a wall and then you finally graduate to some kind of other surface where you're more angled and you may still not be able to go down all the way. And then you're using a bench or a kitchen countertop, whatever, or the back of your car trunk, and you still can't go down all the way. And so there's that incompleteness, that incomplete range of motion that for some people could be off-putting, it could be demoralizing. Why not just stick to dumbbell presses lying down or at an incline, as well as seated chest presses? That way, no matter how weak you are, you can start doing it with full range of motion. For instance, if you're using dumbbells, you can use 5-pounders if you're really weak. Or if it's a seated chest press machine, you can put the pin at the lightest weight, which for some machines is 10 or 15 pounds. No matter how weak you are, you can push that with full range of motion. It's not demoralizing. And over time, you can see definite improvements, objective improvements, as you take that pin and use a heavier weight. 30 pounds, 45 pounds, 60 pounds, whatever the incremental increase is. Same with using dumbbells. 5 pounds, you now are using 7 or 8-pound dumbbells. You're now using 10-pound dumbbells, 12-pound dumbbells, 15-pound dumbbells. So you can see the improvement incrementally and objectively, all while maintaining safe form. Another version of chest pressing is using resistance bands. You could anchor one behind you and take the handles and push out like this. The bands come in different resistance or tension levels, and that's designated by having different colors. So the yellow band is very, very, very easy. And then the green band is kind of like intermediate. The blue band is more advanced, it's a little bit tougher. And the black band is the toughest. And there's different kinds of different makes and models of tension bands, but there's no reason why a fat person should be doing push-ups. There's just no reason. It's, again, very defeating because you're not going to be able to do them. It's like trying to do pull-ups. You just can't do them. See, now, if you're thin or if you're medium weight or just even a little bit overweight, there's nothing wrong with trying push-ups out because, yeah, I've seen kind of husky people, including women, actually doing push-ups on the floor with good technique. They're not too heavy to eventually get to that point. But when you're Anna's size, it just makes no sense. Again, it's just for show. It's only a matter of time before she hurts her rotator cuff. And it's not necessarily something that's going to just happen real instantly. Oh, like that. It could be gradual, it could be insidious over a period of days or weeks. And then suddenly you realize, oh my gosh, every time I do push ups, this hurts. When I lift my arm up like this, it hurts. When I do this, it hurts. And then once it gets to that point, it just takes months and months to heal. You got to stay away from push-ups. You got to be real careful about other exercises you do and stuff you do around the house, like putting things on a high shelf. It's an inflammatory situation. So my advice to Anna, and then this is common sense. You don't need to have a master's degree in exercise physiology or kinesiology or some other type of or rehab medicine to know that just the basic push-up can harm the rotator cuff if number one, you're using incorrect form, and number two, you're 330 pounds. Now, you might be thinking, well, she's losing weight. Well, she's got a lot more weight to lose before doing push-ups makes any sense. She should just stick to dumbbell presses or even barbell presses. That would be very safe if she was doing bench pressing with a barbell, if she has access to a barbell. Again, you could just start out with the 45-pound bar. Some gyms or fitness centers have 20-pound bars. You can start out with 20 pounds, 30 pounds, go up to the 45-pound bar, and then start adding 5-pound plates. Add 2.5-pound plates on either side when you start feeling a little bit stronger. Again, you could make increases incrementally, and you can do safe form. But push-ups, I mean, it's just a rotator cuff problem waiting to happen. It's only a matter of time. So any fitness trainer, any halfway decent fitness trainer would advise Anna to stop doing the push-ups. She doesn't need to do them to lose weight. It's not going to do anything to help for weight loss. It's only minimally increasing her strength. In fact, the only way her push-ups are making her stronger is making her a little better at doing these push-ups. What's really going to increase her strength are the dumbbell presses. But the push-ups, she essentially is only going to get better at doing push-ups with poor form. And like I said before, the greater her range of motion as she's continuing to do push-ups with poor form against significant weight resistance, the more likely she is going to start feeling pain in her shoulder, making it painful to raise her arm like this and or go overhead or do motions like this. And then once that happens, months and months to heal, because tendons don't have a lot of circulation. They don't have a lot of blood circulation. So tendons are stubborn. They like to take their sweet old time when it comes to healing. So that's it for today, and have a good day.